Good morning. I'm here with Pastor Broussard, Greater Pure Light Church. Very, very happy to be visiting our community here in Aldine, and so many folks who are getting their vaccine. We've been doing great in terms of administering the vaccines we receive in Harris County Public Health. Our FEMA supported site at NRG, for example, has hit every single goal the federal government has given us. There are some sites around the country that struggle to find the folks to get those vaccines out the door. They're supposed to be around 6,000 a day, but every single time we're able to hit those numbers. Just this week, day before yesterday, we vaccinated over 7,000 people in one day at NRG, which was our record, beat the previous record by about 500 vaccines. So far, we've administered well over 300,000 vaccines Harris County Public Health has. But I don't want people to believe, Pastor, that we only administer vaccines at these large sites like NRG. The truth of the matter is, we have been administering vaccines at over 77 sites like this church. We've been going to community centers, we've been going to communities of faith, we've been going to assisted living facilities, to all kinds of entities, particularly in the hardest hit zip codes. From the beginning, we recognized that it was very easy for there to be unequal access to vaccines, and that in order to get past this, all of us needed to be able to get vaccinated, that we can't possibly reach herd immunity if we don't have all communities receiving this vaccine. And so we devised a registration system that was fair and didn't just benefit those with internet access or with connections or with a lot of time on their hands. It's a randomized system. It's a list that you can register for via phone in multiple languages online that never closes. It's not first come, first serve. We identified the hardest hit 25 zip codes and have been targeting those zip codes, the zip codes that have had the most cases per capita, the zip codes that don't have access to health insurance, to transportation. This is one of those zip codes. It's number 13 on the list. And of all the zip codes in Harris County that are the hardest hit. And that's why we're here. It's not because Pastor and I didn't even know each other. It's not because there's any special knowledge or any special interest. It's because this is a hard hit zip code. And that's how it's been as far as where Harris County Public Health is focusing its vaccination efforts. We've been going door to door in many of these zip codes. We've sent mailers, we've sent radio ads, we have sent digital ads. We're working very hard to support that. For folks who don't have access to transportation, we provide rides to our sites. For folks who want a one-shot vaccine, a two-shot vaccine, we're able to accommodate that. And so we're here as part of this effort that we're going to continue to grow, to go to different areas. But we can't do it alone. We need community partners like the pastor and his community who've been so incredible at informing folks here that we're having this vaccination site. But also folks like everybody in Harris County who has received the vaccine and folks who've not received the vaccine. It takes two to tango. It takes not just us providing the vaccine and hustling to try and get those vaccines out the door, but it takes the community getting those vaccines. So please register. ReadyHarris.org, 832-927-8787. And if you got your vaccine, and I was talking to the folks here today asking them, help us spread the word. Tell your family, your friends, your community that you got the vaccine, that it's safe and effective. The most effective way to make sure we all get vaccinated is through that word of mouth. And I just see the joy here. I got my vaccine last week. I felt happy. I felt relieved. That's what I'm seeing from the community here, the folks that have gotten it. So join us, get your vaccine, and know that we have sites throughout the county that are constantly rotating, so take advantage of that. Look out for us showing up to your community, if you're particularly hard-hit community, and either way, when you register online, register via phone, you'll be given the options as to the areas that are available that week, so you can choose one that is nearer you. If you're not able to get there anyway, let us know, we'll go pick you up. So we don't want anybody to have any trouble getting vaccinated. Thank you, Pastor. I'm going to repeat my remarks in Spanish very briefly. Estamos aquí en la iglesia de la luz pura, a Greater Pure Light, iglesia aquí en Aldin con el pastor Broussard y su comunidad. Y esta es una de 77 sedes de vacunación que ha establecido el condado Harris. Nos ha ido muy bien en nuestra sede principal en NRG. Hemos logrado alcanzar todas las metas que ha puesto el gobierno federal, vacunando las 6,000 personas diarias que nos han pedido que vacunemos. Inclusive estamos batiendo récords. Antier vacunamos más de 7,000 personas en NRG. Ese es un gran récord, es un gran éxito, pero no quiero que la gente crea que solamente vacunamos a las personas en ese estadio de NRG. La realidad es que hemos venido vacunando a la comunidad en iglesias como esta, en centros comunitarios, en ancianatos, en todo tipo de áreas, en 77 comunidades a lo largo de este condado, y vamos a seguir haciendo eso. Vamos a seguir reconociendo que hay que eliminar esas barreras, esos obstáculos a la vacunación. Por eso tenemos una campaña de comunicaciones donde vamos puerta a puerta, donde enviamos correo, enviamos mensajes por radio, mensajes por internet. Por eso hemos identificado los códigos de postal más impactados, los 25 códigos de postal más impactados por este virus, de acuerdo a cuántas personas han salido positivas, dependiendo de la población, también si es qué comunidades faltan acceso a transporte, qué comunidades no tienen acceso a seguro médico. Hemos identificado esas 25 códigos de postales más impactados y ahí es donde estamos enfocando nuestros esfuerzos. El pastor y yo ni siquiera nos conocíamos antes del día de hoy. No queremos que las vacunas vayan a aquellas personas con una conexión especial, es a los códigos de postal más impactados. Por eso también hemos priorizado esos códigos de postal en NRG. Por eso hemos facilitado el transporte. Aquellas personas que no tienen acceso a un automóvil, las ayudamos y vamos y los recogemos. Ofrecemos las vacunas de 1 dosis y de 2 dosis, dependiendo qué prefiera la gente. Vamos a seguir trabajando en todos esos esfuerzos, viniendo a comunidades como esta. Pero necesitamos ayuda de ustedes también. Hay muchísimos héroes en este esfuerzo. Todos los líderes de salud pública, personas como el pastor aquí, que han invitado a su comunidad, directores de escuelas, tantos líderes de familia que están luchando a través de este reto. Para celebrarlos a ellos, todos debemos vacunarnos. He visitado aquí, las personas están contentas, igual que yo. La semana pasada me vacuné, estuve feliz, me sentí muy aliviada. Veo eso, las personas con las que estoy hablando, es un alivio enorme. Entonces acompáñenos, pónganse su vacuna. Recuerden que pueden registrarse por teléfono en 832-927-8787 o por internet en readyharris.org. Recuerden que si ya se pusieron la vacuna, ayúdennos a contarle a sus amigos, a su familia, a su comunidad. Invítelos a que se vacunen. No necesita seguro médico, no necesita ser ciudadano ni residente americano. Solamente necesitamos que le dé ese regalo a usted y también a su comunidad, el regalo de la salud. Y eso lo puede hacer a través de la vacuna. I do want to thank Pastor, before I give you any opportunity to add any comments you have, is the so many unsung heroes here. Pastor, your team, our public health team that is here that have been working nonstop since the virus hit us. Now, over a year ago, they've been working nonstop to get this done. School principals, community leaders who've hosted sites such as these, who are getting their community excited about the vaccine. Let's do justice by them and give that gift of health to the community by getting vaccinated and taking advantage of all these different sites that Harris County is offering. Pastor, anything to add?
Well, I just want to say, you talk about unsung heroes. You're a hero in that you've put all of these things together, and I appreciate and applaud your passion for making this particular thing happen. And I want to thank you. I want to thank Harris County Public Health for being here today and allowing us to service our community through the initiative that you've put forth, and all of the staff and everyone who's made it possible. And so it's all about the community, making sure that our community has the ability to get the vaccination so they can get well, stay well, so on and so forth. And we have to do our part as leaders in the community to bring people together. And so I appreciate everything that you all continue to do, and whatever we can do as a church to help your efforts, we're here to do so. So thank you so much.
Thank you, Pastor. Any questions? Okay.
Why does Harris County feel and so ready, and what will it take to get out of it?
Look, I know we're all tired. We're well over a year in, so we want this virus to go away. And the good news is there is hope. There's hope in these vaccines. There's a light at the end of the tunnel. But it's not the time to give up now. Well under a quarter of our Harris County population has gotten fully vaccinated. We have a ways to go. We still have over 550 cases on average daily, new cases reporting, a positivity rate of over 8.5%. Hospitalizations in our ICU, around 16% of those ICU beds are taken up by COVID positive patients. So we laid out a framework early on in the pandemic that looked at all those factors: positivity, hospitalizations, cases, the trend of all of those, and pegged colors to it and threat levels. I don't decide that. I don't set an arbitrary date. The data, the numbers, are what determines whether we hit the threshold. And unfortunately, we've not hit that threshold to orange yet. Now, will we get there? Yes, if we do our part. If we get vaccinated, and if we continue to avoid gatherings with people we don't live with, if we continue to wear the face coverings, that is what's going to get us out of this sooner. So I sure hope, I want it to be over as much as everybody does. We're just not there yet. And the concern is, if we let our guard down right now, then we're going to see unnecessary deaths and hospitalizations that we could avoid because we know that we're on our way out of this. So I hope we don't see a spike, and that's why we're working so hard to get these vaccines out the door.
What's the bigger issue in these neighborhoods with low vaccination percentages? Is it hesitancy or access?
Twofold. You know, the challenge with the communities that are not getting vaccinated is multi-layered, and that's why we have to tackle all of these different layers on one level. It's access. When you have different providers offering only online registration, where if you sign up at midnight you get it, or if you sign up at 6 in the morning you get it, how are people supposed to know that that's the time they have to sign up? What if they don't have access to a computer? What if they're working at the time and they're busy? So that is an initial challenge, and it's why you see with Harris County Public Health, our numbers more closely resemble the demographics of the community. We're not 100% yet with the Hispanic community in particular. It's disproportionately low, but African American community, white, and Asian, Harris County Public Health is distributing vaccines on par with the demographic breakdown of Harris County as a whole, and we're doing much better on the Hispanic community than other providers are taken together. So because we have the registration system that is easy and convenient, and it's not a rat race as to who's got connections, who's got internet access, who's got all the time in the world. The other part is the messaging. There are a lot of myths out there, and they're rampant in various communities, particularly the Hispanic community and the African American community. And so that is the most powerful tool against that, is word of mouth, is people who've been vaccinating telling other people. The truth of the matter is the vaccines are safe and effective, as all the data shows, and so help spreading the word. And then there's deeper structural issues: lack of access to health care, lack of access to health insurance, pharmacy deserts. You got pharmacies giving vaccines. What if there isn't a pharmacy in the community, one of these big chain pharmacies? Lack of access to transportation. So that is why, some people simply feel more comfortable getting the vaccine at a place like their church. So that's why it's so crucial to have these partnerships, as with this church, to be able to go deep into the community and help tackle those challenges.
The follow-up to that is, what is the county doing to address these challenges?
We're doing various things. So we've set up a registration system that is fair and equitable, a randomized system that's not first come, first served, that never closes, and that you can register via phone or online in multiple languages. We are also going to various communities, specifically the hardest hit zip codes, to address the transportation and the trust issues. And we're working, we've instituted a media campaign in various languages, again targeting the hardest hit zip codes, to try and dispel these myths. But the most powerful tool really is not us. It's the community and the people that are getting vaccinated. So I call on them to spread the word, and I call on the other entities administering the vaccine to lower those barriers to entry, to make the registration process fair and effective, and to inform the community that you don't need health insurance, you don't need to pay to get the vaccine, you don't need to be a U.S. citizen to get the vaccine. Everybody needs to get the vaccine.
I have a few more and then one in Spanish. How long do you expect it to take to even out vaccination rates between neighborhoods?
Oh, it's all in our hands. How quickly we can really, number one, hit herd immunity, but also make sure that there's this equitable distribution of vaccines so that all of us can get out of this together. And right now, we have a limiting factor is the number of vaccines available. We're able to give more vaccines than we receive from the federal government and the state government. But if you look around the corner, there is a concern that at some point we may have more vaccines than there are people willing to take them. And so that's my fear, and what I want to get ahead of by having these kinds of events is, if for every person gets a vaccine, the folks around them hopefully will get the vaccine too. So how long? I mean, look, we could be through with this by, into the summer if we get vaccinated and spread the word. If we don't, it's a race against time against these variants. So let's all do our part, get vaccinated and spread the word.
This is back to code red. It says, are you considering lowering the COVID threat level from red? And if not, what is the criteria to get it lowered?
The decision as to what our threat level is not something that I decide based on a feeling or based on an arbitrary date, like some folks have done, and said, well, we want to open everything by such and such date, because the virus doesn't abide by arbitrary deadlines. So we've set out this system. We worked on it with the researchers and epidemiologists at Rice University and Baylor, and they helped us look at around the world, around the country, helped us develop this system. They've looked at it, had independent folks come in and look at it already 2 or 3 times to make sure we don't need to tweak it. For example, recently we added the criteria for folks who've been vaccinated. So it's a little bit different. If you've been vaccinated per the CDC, you can do things a little bit differently, still cautiously, but a little bit differently. But the reality is this threat level system is an accurate representation, per the experts, of the impact of COVID-19 on the community and what we should do to try and keep not just the community healthy, but also generally, the economy is tied to the health and people's confidence in being able to go out. So what will it take? It will take the positivity going down to 5%. It will take the daily cases going down to 400 a day. It will take the ICU population going down to 15%. We're close, but things are flattening out. So we got to keep doing our part.
Okay, only 3 more.
Mm-hmm.
What is your reaction to declining hospitalization cases and
Good news so far. So I'm cautiously optimistic to see the numbers trending down, but there's a couple things that give me pause. One is some of these numbers are flattening out. They're not lowering as quickly as they were before. And that's what happens every time before things start going back up again. Second thing is, every time there's been a reopening, within about a month and a half, the numbers have begun climbing back up. First cases, then the positivity rate, eventually hospitalizations, and finally deaths. So, we're about to hit about a month and a half since the last reopening. I hope we don't see what we've seen already 2 or 3 times over, but we can't say for sure. So let's hope that those numbers keep trending down. That's why we're vaccinating people as efficiently as possible and continuing to ask folks to take the common sense measures of avoiding gatherings with folks that you don't live with, wearing a mask. It's not forever. It's just for as long as COVID, and we know we can get through it in a couple months if we get vaccinated, if we do our part. So, hopefully we'll get there soon.
Judge, I'll read this one just as it came in. Today marks 4 weeks since the state fully reopened and the mask mandate ended. At the time, you said Governor Abbott was playing with people's lives. Since then, cases, positivity, hospitalizations, and deaths continue to fall. Knowing this, do you still think it was a mistake to open the state? And it's got a couple follow-ups. Also, do you think Texans are doing the right thing?
I hope I'm wrong. I hope I'm wrong. And when I said it's too soon, that it turned out to be perfect timing. The truth of the matter is we don't know yet. We don't know because it takes about a month and a half from when there's been a reopening. If you look historically, that's when things usually begin climbing up. And then it takes longer for things for the numbers to really worsen. Now, maybe we've vaccinated enough people to where that won't happen. If you look around the world, several areas that have vaccination rates, high vaccination rates that open quickly, still saw their numbers trend. So that's why I'm asking the community, don't risk it. Let's not play with people's lives. Let's recognize that this is close to over, and we will unnecessarily lose more people if we don't continue with our common sense measures. Look, I got vaccinated last week, but I'm still wearing my mask. I'm still avoiding gatherings with folks I don't live with, because by doing that, you're making sure you're not spreading the virus to other people. The jury's still out as to exactly how the vaccine helps with that. A lot of folks, the vast majority of folks in this community, still haven't gotten fully vaccinated. A lot of the virus still out there. 550 new cases every day. That's 550 new people each day out there able to spread the virus. So I hope I'm wrong. We're here because I want to make it wrong, but we'll see. We gotta be cautiously optimistic.
Okay, a couple of follow-ups and then we move to one in Spanish. With numbers falling, do you think at this point neighbors know how to keep themselves safe without a government mandate?
You have to look at the impact we've had every time there's been a reopening, and this feels like deja vu, same kinds of questions I was taking a year ago today after the first reopening, where everybody said, well, where's the crisis? And then fast forward a few weeks, the numbers climbed, and the same thing happened after the reopening in the fall. Just in July, we lost 1,400 people in 1 month. In December, we're still waiting for the count, but it was an even higher spike, and we're really playing with fire in terms of overwhelming the hospital. So let's not let that happen again. I've seen a decline in folks wearing masks. I still see a lot of people wearing them, so I'm grateful for that, people doing their part. I know of businesses that have continued enforcing the mask, that have continued enforcing the occupancy requirements to keep the community and the employees safe. I commend that. We need to continue doing that. And, the numbers will show. So it's that. But the new thing we have now, which is just a wonderful, wonderful thing, is the vaccines. So it's twofold. Doing our part in the precautions, but also getting vaccinated. And so if we do that, then we'll be through this very soon.
This one I'm going to read exactly as it came. Harris County has been in the red COVID-19 threat level for nearly a year. Meanwhile, Fort Bend County has moved its meter several times since last summer. Over the past year, much has been learned about the virus. What scientific reasoning is behind keeping the metrics on the meter the same as last summer, and what will it take to reduce the threat level?
Yeah, well, we've developed the threat level system with the researchers and the scientists from Rice University and from Baylor. We've had it reviewed. We've looked at best practices around the country, looked at best practices around the world. Unlike a lot of different systems in other jurisdictions, we are deciding these numbers or these threat level designations not based on how I wake up feeling any given morning or what the team considers to be politically expedient. It's based on thresholds that were laid out that are not going to change unless there is a scientific reason for changing them. And we just got through reviewing them again, and the experts tell me there is not a scientific reason to review them. You've got to put our numbers into context. I mean, we've lost over 3,000 people in Harris County to this virus. We have had hundreds of thousands of cases. That's not normal. That is not okay. There are countries where, I look at New Zealand as the population of Harris County, they've a handful of deaths, a handful of cases, you know. We can't be numb to the losses and the deaths, and we still are powerful in preventing this. So I would love, and I'm sure I would get a ratings boost, as the governor, bragged when he made his announcement, to say, let's open everything. This is over. Good news. Everybody loves to deliver good news. But unfortunately, my job, as I see it anyway, is to protect the community, to follow what my advisors, expert advisors, epidemiologists, independent scientists are telling me, and not to simply create false hope. Because you create false hope, you're causing unnecessary deaths and hospitalizations, particularly when we have a light at the end of the tunnel.
Last question, and this is one that they would like in English and Spanish, and it actually is a bit about both. It says, in reaction to Lieutenant Governor Dan Patrick's comments on the Texas election bill, as he accused the Democrats of race baiting, also saying Harris County elected officials are lying about what the legislation would do.
You know, I heard about those comments, and I'm bewildered and frankly saddened that someone would attack their own constituents. There were attacks on Harris County writ large. Harris County is 5 million people. Harris County is 5 million Democrats, Republicans, Independents, a beautifully diverse community, people of all ages and backgrounds, and it's my community, the community I represent, and I represent all of them. I'm proud to make it easier for everyone to vote. Republicans and Democrats voted in record numbers in the fall of last year. Republicans and Democrats thanked our team for drive-through voting, 24-hour voting, the mail ballot conveniences that we tried. We should all be celebrating that, and I continue to be concerned about the legislation that's coming down the pike. It's the same story as before. At some point, it was about, you got to have a poll tax to collect government revenue. Then another time, you had to have literacy tests to have a so-called informed voter population. And it's not lost on me. We are here in this church, Pastor, talking about this. Yes. And now, you're saying that you gotta limit voting hours, that you gotta micromanage the voting locations, which will cause long lines, that you gotta cancel drive-through voting and 24-hour voting, that you're gonna create obstacles for voting, people who need to vote curbside or send mail ballots. They're calling that something about election security and election fraud. It's the same old story. Suppression under the guise of some excuse. Some excuse in 2021 is election fraud that does not exist. So let's keep calling it what it is. It's Jim Crow 2.0. It is unacceptable, and I call on companies to stand up, be on the right side of history. We all say we would have been there marching with Dr. King. We all say that. Well, the march is on. Come march.
In Spanish, if you can as well.
Sí escuché acerca de los comentarios que se hicieron, Y realmente estoy entristecida y algo alarmada por estos comentarios. ¿Por qué? Porque fueron un ataque hacia el condado Harris en sí. Él dijo algo así como, el condado Harris no es tal cosa, tal otra. El condado Harris son sus propios miembros de la comunidad que él representa como un líder estatal. El condado Harris son 5 millones de personas. 5 millones de personas, tanto demócratas como republicanos, de todo tipo de historias, de edades, una comunidad hermosa y diversa, y es mi comunidad que yo represento. Yo represento tanto a los republicanos como a los demócratas, y me enorgullece muchísimo el haber facilitado el voto de ambos partidos. Tanto republicanos como demócratas nos dieron las gracias el año pasado por la conveniencia del voto por autoservicio, del voto a las 24 horas, lo que hicimos para facilitar el voto por correo, y ambos partidos participaron a números récord. Eso es algo que me enorgullece muchísimo y que no debemos atacar. Y sí estoy preocupada por estas leyes que están intentando pasar en el Estado. Hay que recordar la historia de los límites al voto en este país. En la historia se ha intentado requerir que se pague, que las personas paguen para poder votar, así no permitiendo a las personas de bajos recursos el voto. La excusa ahí era que había que colectar recursos para el gobierno. También se han hecho pruebas de aptitud, pruebas injustas para prevenir que la comunidad afroamericana pudiera votar. En ese entonces se decía que los exámenes eran para asegurar una población votante informada, supuestamente. Hoy día están intentando limitar las horas, están intentando manejar el número de sedes de votación, lo cual creará largas líneas. Están también creando obstáculos para el voto por correo, el voto por autoservicio. Todo eso lo están haciendo en nombre de la seguridad electoral, cuando sabemos que no hay evidencia de fraude. Entonces simplemente es una excusa. Todos sabemos la historia de derechos civiles, de lucha por la igualdad en nuestro país. Y todos decimos que si hubiéramos estado ahí cuando el reverendo Martin Luther King lideraba la marcha, que nosotros habríamos marchado. En este momento está la marcha. Entonces hay que unirnos a eso, hay que invitar a las compañías, los líderes de negocios, los líderes de la comunidad. La democracia depende de la habilidad de todos de participar, republicanos, demócratas, todos. No dejemos que este país se debilite la democracia.
Thank you.
Oh, thank you, Pastor.
Thank you.